I kind of want to talk about your recommendations. We got a few minutes left. I want to make sure that we hear any recommendations you have for patients, both chronic and the new ones. Um, what do you think? Tell us where to go. Tell us what to do, right?
Sure. If you are a new patient, if you just started having dizziness symptoms, get in to see a vestibular PT or an ENT or a neurologist who understands dizziness as soon as possible. The sooner you get seen, the easier the diagnosis is going to be, and the more support you're going to have through the process. And that lessens the risk of developing more of a chronic dizziness syndrome if you can get seen more quickly, right? Because if it is something like BPPV, it can be treated effectively and quickly, and the residual symptoms or the worry about, all right, when's this going to happen? Right, that you kind of described with, I don't want to move my head. Those symptoms can be alleviated much more quickly and prevent that progression to the chronic dizziness.
That's interesting. And it sounds like mental health is a big component, right? And I think that's one where maybe this video, maybe others, just to understand that the practitioner side understands this and should understand it. That's something we can hold the practitioner accountable for, is knowing that there's a sensitivity to this for us through this journey before chronic or new. This is weird, right? But then also that the treatment side of things for us as patients to understand, and this is something that we own, is that there's no magic pill, that this could be, even in the simplest form, be interconnected in some sort of a system. And it could affect, and it might affect eventually something else that wasn't over here, right? Your neck might get tight because your eyes are off or your ear is off. And don't be weird or don't feel weird that something doesn't make sense. This isn't supposed to really make sense to us because our system is trying to make sense of something that doesn't make sense. It's just the nature of this thing.
Yep. Yeah, for the chronic patients, I think I would say that the process to improvement takes time and it takes effort. And it takes experiencing some things that are uncomfortable. You're a good physical therapist who treats patients with chronic dizziness syndromes understands that well, I'm speaking for myself. I shouldn't say this for all PTs. The biggest thing that I can do in that first evaluation, if I think somebody has a chronic dizziness syndrome like triple PD, is get them to buy in to the fact that this is going to be a process, that it's going to be slow, and that there's going to be bumps in the road, right? Because if you, as you kind of alluded to before, if your expectation coming into the appointment as a patient is, all right, my knee's broken, fix the knee and I'll be good, and that's what you leave the appointment still thinking, there's a pretty good chance that my rehab program is not going to work for you, because I'm expecting it to take weeks to months for patients to feel much, much better in those scenarios. And if your expectation was, well, I'm going to feel better in a week, then we're on different pages and that's not going to mesh very well. So the more that a chronic dizziness patient can understand that it's a process, it's sometimes an uncomfortable one, but that each step is moving you towards improvement, I think is the biggest key. And that you should have somebody who's willing to walk you through those steps. Maybe not hold your hand the whole time. I'm a big proponent of this kind of tiered approach where I might see you, if you have chronic dizziness, once a week for 4 weeks to kind of set this tone and this baseline. But you have to go do this on your own in everyday life if you want to get better. And so I might start after the first month being like, all right, go try this. I'll see you every other week. And then after the second month, all right, I'm going to see you monthly now, right? This is an active rehabilitation process for patients to go through and to have to do with guidance from a practitioner. But we don't have the magic bullet in these chronic dizziness disorders. It's lifestyle guidance, management, and exercise in general that probably play the biggest role.
But I think I heard you say weeks and months for those patients that are suffering for years. we may need a better practitioner, or we may need to be able to, have that conversation with somebody, maybe like yourself, or go on to Vita and say, years is a long time. If they're still uncertain of the actual, if it's a BPPV, if it's something that might be considered treatable, years might be a bit long. There should be some more help that they could seek out, and to reach out to places like, a rehabilitation center, vestibular center like yours, like at Johns Hopkins.
Yep.